It's now time for Global Insight, where we speak to experts from around the world on issues making headlines. Now, blood is quite literally the elixir of life. Every 2 seconds of every day, somebody needs blood, and because it can't be manufactured outside the body and has a limited shelf life, the supply really relies on steady donations. However, throughout the 21 months or so of the COVID-19 pandemic, maintaining blood supplies has been even more challenging than usual. Blood drives have been cancelled amid social distancing, and when communities reopened, fewer people were willing to give blood. The American Red Cross says that donations dropped in the US by 10% from August to September 2021, and that blood supplies are now at a dangerous low. Today, we discuss the blood shortage that's been occurring all around the world and what consequences we will face if the situation is left unmitigated. For this, we're joined by Claudia Kohn, Professor of Laboratory Medicine and Pathology and Director of the Blood Bank Laboratory at the University of Minnesota. Very warm welcome to you, Professor. Thank you for joining us today.
Thank you for having me.
Well, Professor, first of all, as much as we call blood the elixir of life, how are the different components used to save lives?
Blood donations are used quite often for people with cancer, for people who are victims of trauma, whether a motor vehicle accident or some violence, and people who receive solid organ transplants, a kidney transplant, a liver transplant. Those are the major people who need blood. And I'd say that cancer patients are the #1 users.
And well, throughout COVID-19, we've seen the cancellation of blood donation drives, campaigns, and people in general, they've been less willing to go out and give blood. And well, in mid-August of this year, in South Korea, here as well, in this country, the Korean Red Cross reported that blood supplies were down to 3.2 days of worth compared to the 6.5 days of worth in the same time last year. So how should we interpret these numbers? How long can blood be stored, and really what do these numbers really mean?
That's an excellent question. Blood has a limited shelf life. And when I talk about blood, there are red blood cells and platelets and plasma. Those are the 3 different major types of blood that is transfused. Platelets can only stay on the shelf for 5 to 7 days. So we constantly need new platelet donors to come in and give of their blood. Red blood cells can be stored longer, a month, a little over a month. However, if you get down to only 3 days supply, if something major happens where someone needs a lot of blood rapidly, it can deplete a supply for a region, and that can become quite serious.
And well, how has the COVID-19 crisis really affected sort of the eligibility for donors and regulations for blood banks?
In general, it hasn't changed eligibility for donors very much. We, worldwide, we want a donor who is healthy. And although every country is going to have slightly different rules, that is the central theme. And so if someone has COVID, then they can't donate. In the United States, we ask that you wait 2 weeks until after your symptoms have resolved, and then you can donate again. So that has reduced the number of donors somewhat, but I'd say that social distancing has affected the rates of donation much more than simply the fact that people who have COVID cannot donate.
And how have blood banks in the US been affected by all of this?
It's quite serious in the US. In some regions of the US, we are down to 1 day supply of blood on the shelf. You mentioned you have 6.5 down to 3. Here in the United States, most people are comfortable with 5 to 7 days worth of blood on the shelves. We started thinking that we were in a shortage when we were at 3 days worth of blood, but as I said, some places are down to 1 day of blood. Social distancing has reduced the number of people who want to donate. And as you mentioned at the very beginning of this broadcast, there are mobile blood drives, and those are largely canceled. And that continues to be the case because that requires people to gather in large groups, either at a workplace or at a school, and people are reluctant to do so. So there still are good blood donations, blood collections at fixed sites where, like a Red Cross, where people come and donate in days at a hospital. But because the mobile drives are largely canceled, we are seeing a significant reduction in donations.
And this is quite worrying because I hear that the winter months are a particularly difficult time to secure blood supplies. And why is this so?
Absolutely. People don't want to go out when it's cold. It really comes down to that. And if there are holidays, people tend to want to stay home with their families. And so that is another time when you don't see as many blood donations made. So the winter months are always a low time. We're entering a holiday season in the United States, and we're quite worried about the level of blood donations. We're also, we have chronic staffing shortages in the United States at the moment. And that also is affecting the ability to collect blood because blood centers have fewer employees to actually do the work of collecting the blood. So you're having fewer donors and fewer people to collect the blood. We're in a bad place as we enter the winter months.
And really, where does this leave patients, people who really need these blood supplies?
So far, we are hearing stories scattered throughout the United States of patients who cannot get the care that they need. In many cases, this is simply non-essential surgeries that are being delayed because people can delay those. But I think that there are going to be cases where patients simply cannot get the number of units of blood that they need because there is a shortage. So it can be quite serious when patient care is affected.
And well, some people are wondering whether it's okay for them to give blood if they've contracted COVID. Is that okay? I mean, what are some common questions or misconceptions that people have about giving blood during this pandemic?
I'm awfully glad you asked that. You cannot spread COVID through a blood donation, through a transfusion. That has been shown over and over again. That is certain. So any fear of contracting COVID or of spreading COVID through a blood donation is an unfounded fear. You need to maintain social distancing and wear a mask so that you don't spread COVID through the respiratory route, but through the blood itself, it is absolutely safe.
And well, adding to the problem of blood shortages, hospitals, they've had to make quite a lot of adjustments over the last 2 years to accommodate COVID patients. And well, how has that impacted patients that need transfusion? And how about the ripple effect of surgeries being postponed as well?
We have seen a ripple effect. Non-essential surgeries were canceled and in the United States. And for a while, that was a good thing because we had so many hospital beds filled with COVID patients. Then when COVID began to wane for a short time, the first wave in the summer of 2020, we had a lot of patients returning to the hospital in great numbers to make up for the time that they took off early in COVID. And the demand for blood went up. However, the supply of blood did not go up. So that was when the chronic shortage began. Now we had the Delta wave, now we're in the Omicron wave. And so we are seeing an overall ripple effect that continues to occur as patients delay care because we're at the height of COVID. And then the one wave goes down, patients return to the hospital in force, but again, no one is donating or people are not donating at the same rate. So we're not seeing that we can take care of all of these patients. It's quite a serious situation for some hospitals.
And well, I imagine it's affecting lab work as well as blood donations are also used for research. How has that affected research in the United States?
I don't think it has affected research very much. I think the amount of blood that is needed for research is usually small. And researchers in general can get it sometimes simply through their own labs where they ask their people to volunteer. So I don't think that has been affected significantly.
And well, in terms of collecting the donations, what kind of measures had to be put in place because of the COVID-19 pandemic?
Well, social distancing is the most important factor that is put in place. To bring in new donors, we need to encourage younger people to come in and donate, and that's going to be an important factor. The best donors in the United States are the older generation, those who were born in the 1970s. After that, people are less interested in donating, it seems, but we have to find ways to convince younger people to come in and give of themselves, to be altruistic and volunteer to give their blood so that we can continue to have an all-volunteer donor base in many areas.
And well, are there any, well, even before the pandemic began, the blood banking industry has been seeing years of decline in supply. And while many blood banks, some here, here in South Korea, they've been giving out movie tickets, offering incentives to get people to come in and donate blood. Do you think these incentives would work? And also, is it what kind of concerns does this also raise at the same time?
This is a great concern. As I was just saying, younger people are not donating in the United States. I don't know what is happening in South Korea, but we need to figure out how to reach young people. I believe that everyone has an altruistic core where they want to help society, and it's just a matter of tapping that, figuring out what will motivate a younger person to come in and give of themselves. Perhaps their employers need to give them a half day off. Perhaps the government needs to give them a tax credit so that they will donate. There are places that are exploring paying donors to come in and donate. That practice was more common before the AIDS epidemic, and the idea of paying a donor was discouraged during AIDS because it was feared that we would be bringing in tainted blood. There are ways of making sure that the HIV virus and hepatitis C and other viruses are killed in platelets. So that would be safe to pay donors. However, that's not true for red blood cells. And so that is still a concern, that we would need to make sure that the blood is absolutely safe, that you wouldn't be able to transmit a virus. So that is why there's some places that still do not want to pay donors. They're worried that that will increase the risk of a viral disease being disseminated. So I think we need to just get through to younger people and convince them that this should be part of their lives. Every 3 or 4 months, go and donate. It's needed, and it saves a life. It's a great thing to do.
And well, out of the 8 blood types, I hear that the type O is in a critical shortage. Why is this the case?
Group O is the universal blood type. So if you've been in a car crash and rushed to the hospital and we haven't had time to test you, we can give you Group O blood and know that it's safe, that it's compatible. And so Group O, therefore, is used quite a bit. It's used more than the number of people who are Group O who come in and donate. And so having a shortage, it's natural, therefore, that we have a shortage of Group O, and it becomes more important for anyone who needs blood in an emergency, because we need to get you those units as quickly as possible, and those are going to be Group O units. So if you are Group O, you need to come in and donate. You're needed more than anyone else.
And well, because it is flu season, people might feel a bit worried that, they might give someone the virus, or that there might be some health and safety concerns as they give blood. Well, what would you advise them then? And in what ways can we be more mindful of our bodies and our conditions before we go out to donate blood?
You shouldn't donate blood if you're not feeling well. You need to be healthy for yourself, for the safety of the blood supply. So if you suspect that you have the flu, if you suspect that you have COVID, or if you're just not feeling well, don't try to donate. That's going too far. And also that works for everyone else who's at the blood center who is donating, because if someone who is not feeling well comes in, there's a chance that they're going to spread whatever disease they have. So if you're not feeling well, stay home, get better, and then go in and donate, please.
And before we let you go, Professor, what kind of efforts would you like to see sort of internationally in order to really get this message out and encourage people to donate blood?
Well, there is a large effort to just bring people out. And so I would say, if it's true that worldwide younger people are not donating, then we need to make a message where young people donate across the world. There are some countries where blood donation happens far less frequently than others due to societal beliefs, cultural beliefs. We need to change that for the sake of the patients who need blood. Earlier in the program, you asked who needed blood. I neglected to say that women who are having babies, they can bleed a lot and they will need blood. And that happens more often in some countries where there's less blood available. And so these women who are having babies who start to bleed are at great risk. So we need to really encourage worldwide the idea that donating blood is absolutely safe and that it saves a life, and so therefore you're contributing to the greater good.
That was Claudia Escon, Professor of Laboratory Medicine and Pathology and Director of the Blood Bank Laboratory at the University of Minnesota. Thank you so much for your time today.
Thank you for having me.